Some people can't.
Yeah.
Great. I think we still do not understand fully how many can, how many cannot. But there's now more and more study as to, looking at it in a scientific way as to, okay, what percentage of people are struggling? I've seen estimates of, they think over 80% of people have withdrawal symptoms, or at least 50 to 60% of people have withdrawal symptoms. And then they'll have varying degrees of intensity. And I've seen the spectrum. I've seen the spectrum, and it is a spectrum that psychiatrists are not being taught about, or anybody who's prescribing these drugs are not being shown and understanding the spectrum. And how bad it can be for some people. What happens when the brain is disrupted or injured by chemicals, by chemical changes that happen relative to changing drug dose levels too abruptly. And if we look at this, we know this happens. We all know someone should not. What would happen if somebody was drinking heavily on a daily basis and suddenly stopped? They would be at risk for seizures and potentially death. So in the whole adage underlying that is adaptation of the brain. So again, let's come back to some, just biology things that we've learned about humans, is that the adaptation to a substance absolutely happens. Let's just be real about that. Psych meds are psychoactive substances.
Yeah.
Opiate withdrawal. Everybody knows that. Everybody knows that. It's not in question. We just have mistakenly not questioned the other psychotropic spectrum of medications. So, and the era is dawning. The era is dawning, slowly but surely. It really is. There's way more resources. The collective voices are strengthening. It's coming, but it's still woefully slow.
Yeah.
Providers and prescribers are woefully uninformed, and that's sad and scary. But coming back to then what a person goes through. So they'll get the directions from their doctor, cut it in half for a couple of weeks, and then in half again and stop. So for some people, what that looks like, and again, this is the some people who have struggles with it, they go home and try that. And maybe it's the first 2 to 3 days. Suddenly they're like, oh gosh, something's off. Maybe it's the first week or two. They're like, oh, okay, some withdrawal symptoms start to appear. Headache, brain fog, sleep disruption, anxiety, body aches, flu-like symptoms, nausea, vomiting. Those are all very real, very common withdrawal symptoms. Interestingly, for some of the medications that I've seen, specifically, I can remember specific cases with the SNRIs, so like Effexor, Cymbalta, Pristiq, or SSRIs. For some people, that withdrawal syndrome doesn't show up and peak until 3 months after discontinuation of the medication. 3 months. So there you have somebody totally losing it, totally freaking out, because they're like, oh my gosh, I suddenly feel awful, horrible. And it's a new kind of awful and horrible. It's not like, and here again, providers desperately need to be educated about how to identify withdrawal versus the original distress. Because what will happen is, in that, whether it's the first 2 days or it's 3 months later, that person will go back to their doctor and report their symptoms. So any of those withdrawal symptoms, and they'll include mood and anxiety issues. So the most common thing they'll hear is, see, you're sick. You need that medication. So you need to go back on it, or you need more. That's, to go back on it and just be reinstated is the most benign thing. That's what I hope for, because when people get switched then, or things get increased, that's where even more trouble can come in, because you have a brain already in withdrawal. It's already disrupted and hurting, and then you're going to make another change.
Yeah.